COVID-19 preparedness and response to emerging public health threats. The COVID-19 pandemic is a stark reminder of the various gaps that have been in existence for far too long, which have impeded member states' ability to prevent, prepare, and respond adequately and effectively to health emergencies. We commend the resolve of member states to transform the global health architecture in this regard, with WHO at the center. In his address, the Director General identified 5 priorities to accelerate progress towards the triple billion targets and the Sustainable Development Goals for the next 5 years, which include the urgent paradigm shift towards health promotion and prevention, the reorientation of health systems towards primary health care, strengthening the global architecture for preparedness and response to health emergencies, the development of research, innovation, data use, and digital technology, and finally building a stronger WHO. These priorities are important not only for WHO, but also for member states. Namibia wishes to voice strong support for these priorities, and we underscore our commitments towards the implementation process. Namibia is pleased to note the progress made in the prevention and control of non-communicable diseases and encourages the Secretariat to redouble its efforts in order to meet the set targets. I thank you, Mr. President.
Thank you. I now give the floor to the delegate of Philippines, and I invite the delegate of Congo to come to the rostrum.
Your Excellencies, Madam President, Director General, ladies and gentlemen, good noon to all. The Philippines joins the 75th World Health Assembly with a firm resolve to support the multilateral health architecture as a channel of peace. The framework and mechanisms used by the international community to fight COVID-19 are testaments to the importance of international health cooperation. The phenomenal speed with which vaccines were financed, developed, regulated, and shared was made possible only through global solidarity. Health and peace must exist together. We cannot achieve our vision of 1 billion more people protected from health emergencies if actions disrupt peace and result in new public health emergencies. We can only see 1 billion more people enjoying better health if interventions do not cause harm and are able to build peaceful societies, such as a community without vaccine nationalism and open to the sharing of health information and technologies. Universal health coverage means ensuring that our visions include the most marginalized populations. The Philippines seriously invests in social health insurance coverage for former combatants. We consider health coverage as the most important benefit to uplift their quality of life. Indeed, the nexus of health and peace is indispensable in the achievement of every sustainable development goal. The realization of WHO's Global Health for Peace initiative is crucial both at the global and community levels. Universal health care goals should be anchored on a high-level political will that translates into accessible primary health care. The Philippines welcomes the significant progress made in the Working Group on Sustainable Financing and the Working Group on Strengthening Preparedness and Response to Health Emergencies. We look forward to inclusive, transparent, and member state-led discussions through the intergovernmental negotiating body, as well as consultations on proposed amendments to the international health regulations. Whatever the outcome of our discussions may be, we must ensure that they become instruments of peace. The Philippines stands ready to move forward with the global community in the pursuit of health and peace for a healthier and happier humanity. Thank you very much.
Thank you. I now give the floor to the delegate of Congo, and I invite the delegate of Barbados to come to the rostrum.
Madam Chair of the 75th World Health Assembly, Ministers, Director General of the World Health Organization, distinguished participants. By expressing the joy of meeting you once more in this room after almost 2 years of working remotely, first of all, on behalf of the delegation of the Republic of Congo, I would like to address my congratulations to Dr. Ahmed Roble Abdile, Minister of Health of Djibouti, on his election to chair the 75th meeting. Be assured of the sincere support of Congo for the success of our work. Director General Dr. Tedros, I would like to transmit to you the congratulations of my country for your indefatigable, determined work to face the public health challenges, and I'd also like to congratulate you on your re-election. Madam Chair, the subject of the link between peace and health is an invitation to find the ways and means to have a universal improvement of healthcare in order to guarantee equitable well-being. Congo, my country, has been through internal armed conflicts. And speaking to you here as a general, I have carried out military operations in the field and negotiated the ceasing of hostilities and have participated actively to work for peace, all under the guidance of our President of the Republic, Denis Sassou Nguesso. Based on this experience, the President has made peace his credo and quickly understood that peace is a condition which is essential for development in general and for the building of a healthcare system for all. This subject sends us straight towards a responsibility to have sustained solidarity, and without it, the achievement of the SDGs that all states have adhered to will be in vain. So, in the light of the lessons learned from COVID-19, efforts are required to leave behind certain current practices which do not meet the message of the WHO. With the objectives of the triple billion, which aims for the well-being of all everywhere, my country has used the 13th GPW to draw up its strategic documents, in particular National Health Policy and the Government Action Plan, with healthcare as the first line. When we come to the fight against the coronavirus pandemic, the approach which is called the Community-Based Response to COVID-19, has meant that we could involve the populations concerned in the front line when it came to preparing our national plans. This approach that we want to see as adaptable to all healthcare emergencies is now with us. In view of the recrudescence of epidemics of Ebola in our sub-region, it's essential to strengthen both of the Congos in rapid detection so that we can have good epidemiological surveillance throughout along the river Congo and have a suitable response. So, taking into account the major disruption of healthcare services following COVID-19, I would like to call once more on our technical and financial partners to maintain, to the benefit of our country, their support on the programs to fight against HIV, malaria, and tuberculosis. I thank you.
Thank you. I now give the floor to the delegate of Barbados, who will be followed by pre-recorded intervention by the delegate of Morocco.
Thank you, Madam Chair, Director General, distinguished delegates and colleagues. I'm honored to address the 75th World Assembly on behalf of Barbados, particularly at this juncture in global health agenda that is filled with uncertainty and rapid change. The last 2 years has been difficult, but countries across the globe have risen to the challenges of the pandemic, and many of us come out stronger, more resilient, and with the expectation that our tested healthcare systems will have been improved and strengthened. Barbados sincerely thanks the Director General for his outstanding leadership of the WHO and the Secretariat for giving guidance and support during these trying times. Dr. Tedros, Barbados looks forward to working with you during your second term. As we move towards a new phase of living with COVID for the foreseeable future, it is time to rededicate and renew our efforts to ensuring that public health and primary care programs, such as NCD's climate change, food security and safety, antimicrobial resistance, human resources for health, and maternal and child health, be given the utmost attention. Barbados remains indebted to the WHO and PAHO for their continued technical and financial support over the last 2 years. Your organization has given support and advice, and you have steadied the ship into calmer waters. Barbados is highly supportive of the team of the 75th World Health Assembly, which promotes peace for health and health for peace, and shows the determination of the Secretariat to engage in matters traditionally outside the remit of the health sector. We believe that in our quest to improve the lot of our citizens across the globe, special attention must be given to small island developing states, many of whom have fragile economies based on tourism and agriculture, are vulnerable to external shocks, and do not have the human or financial resources immediately at their disposal to address the global health crises. AMR poses an enormous yet neglected threat to global public health, associated with almost 5 million deaths per year. Recognizing this, Barbados has revamped its National Action Plan to address this multi-sectorally. We therefore are very proud that Barbados' Prime Minister Mayor Montley is the co-chair of the Global Leaders Group on AMR that advocates for political action on AMR, including increasing global recognition of the nexus between AMR and climate change. With this in mind, we further request the Director General to engage and support critical areas such as climate change, water resource management and sanitation, and NCD prevention and control, and vaccine equity in the near future. It is an honor and privilege to address you. Thank you.
Thank you. I now give the floor to the delegate of Morocco for pre-recorded intervention, who will be followed by pre-recorded intervention by China. Probably we have some technical difficulties. So now I would like to give the floor to the delegate of Belarus and to invite the delegate of Zambia to come to the rostrum, and then we will go back.
Спасибо большое.
Thank you very much indeed. President, Director General, ladies and gentlemen, we are grateful to the Director General for his comprehensive and informative report to this Assembly, and he has highlighted the major initiatives taken by WHO, particularly the Peace for Health initiative. And he has also indicated what is done in terms of combating outbreaks that may be caused by particular disasters or other problems that occur in the world. We recognize the key role played by WHO, and we know that health has to be seen by all parties to any conflict as a common good, as something that indeed is vital. And we therefore believe that peace through dialogue, inclusivity, participation, confidence building is the only way forward for all of humankind. In accordance with the rules of WHO, we have provided assistance to those suffering in Ukraine, both within the borders of that country and beyond it, in terms of providing them with medical care and assistance. All countries of the world, including ours, believe that it is vital to maintain access to medical care and medicines, even in the most difficult conditions. And therefore, we recognize that our political will has to be put to that end. We seek to keep open corridors to ensure that medical equipment and medicines can be provided as required, and that medical and technical assistance can be provided where it is needed. Now, turning to our efforts to combat and to cope with the COVID-19 pandemic, we are very grateful to WHO for its governance and the leading role it has played. In particular, we know that thanks to what we have been able to do in WHO, we were able to ensure that throughout the country we had a very active network of medical establishments that could provide treatment and indeed vaccination. Even the most remote parts of our country were covered thanks to the plans that we have undertaken. We have developed plans that allowed us to cope with the pandemic, and we were able to ensure that more than $2 billion from our reserves could actually also be devoted to providing assistance to others. In fact, we took an approach that allowed us to prevent very strict lockdowns in Belarus. We were able, thanks to our plan, thanks to the innovative decisions that we had taken, to cope with this problem without creating any public excessive anxiety or hysteria. Our vaccination campaign is also something that we are working on very actively, and we're seeking to develop our own vaccine, which we very much hope could be exported to other countries through the appropriate WHO mechanism. Ladies and gentlemen, the world is very turbulent, and that being so, we all recognize that the issues we are dealing with here are particularly topical. We must ensure that if there are problems with health, then we do not allow them to aggravate other problems in the world in general, that's to say general development issues. And we have to recognize the importance of this at both global and regional levels. Belarus very much wishes to cooperate constructively in seeking to build a better world, to improve situations that exist where there are problems, and we are certainly willing to do our utmost to help us all together to craft decisions that will allow us to better manage global public health. Thank you.
Thank you. Now I would like to give the floor to the delegate of China for the pre-recorded video, and then would like to invite the delegate from Zambia.
Madam Chair, Honorable Director General, distinguished ministers and colleagues, first of all, please allow me to congratulate you on your election, Madam Chair, to this year's Assembly. As the President Xi Jinping has pointed out, that currently changes of the world, transformation of our times and history are unfolding in unprecedented ways, and these changes are posing challenges that must be taken seriously by all humanity. We have yet to walk from the shadow of once-in-a-century pandemic, but new traditional security risks are already emerging. So it is essential the countries support each other and better coordinate response measures and improve global public health governance so as to form strong international synergies against the pandemic. Against this backdrop, our theme of this general debate, Health for Peace, Peace for Health, is of great significance. The Chinese government adheres to the governing philosophy of putting people up in front and has vigorously promoted the Healthy China initiative and building a global community of health for all. And these endeavors are highly consistent with WHO's ideal that the health of all people is fundamental to the attainment of peace and security. And China's government has always put people's life and health first, which is the starting point and end goal of all the measures taken. Over the past 2 years, and according to the changing characteristics of the pandemic and its own national conditions, China has optimized and adjusted its prevention and control measures and treatment protocols and has effectively coordinated epidemic control with socio-economic development. And China's government adheres to the philosophy of putting people's life first and upholds the strategy of preventing the rebound of domestic case while strictly controlling imported cases and the dynamic zero COVID policy. Now we have entered a new stage of epidemic prevention and control, which is a comprehensive strategy, and scientific and targeted measures and dynamic zero COVID policy are adopted. China firmly supports WHO's leadership and coordinating role, and was the first to make and deliver the commitment to making the vaccine a public good. We have made positive contributions to global fight against the pandemic and by providing supplies, vaccines, and dispatching teams of medical experts overseas. So far, we have provided over 2.2 billion doses of vaccines to more than 120 countries and international organizations. Furthermore, we have taken the lead in a joint vaccine production with developing countries and have developed an annual production capacity of 1 billion doses overseas. We call on all countries to work together to close the immunization gap. Currently, the pandemic is still raging at a high level. The virus is still mutating, and the future remains uncertain. China will continue to support WHO in playing its central role to promote the equitable access to vaccines and other public goods and to strengthen the health systems of developing countries. We call for joint efforts to fight against the pandemic and oppose any politicization and stigmatization of the pandemic.
Before proceeding to the next delegate, I would like to share with you that we are lacking of time, so I have to apply the rule that I will be interrupting after the third minute is gone. I now give the floor to the delegate of Zambia and invite the delegate of New Zealand to come to the rostrum.
Thank you. Your Excellency, Madam President, the Director General, colleagues, honorable ministers, Your Excellencies, ambassadors, distinguished guests, distinguished delegates, ladies and gentlemen, I wish to align my maiden statement as Minister of Health for Zambia to the one made by Togo on behalf of the African region, and start by congratulating the Director General on his re-election, which is a show of the confidence in him and the team. One thing that struck me upon my arrival in this beautiful city was seeing people moving around freely without face masks. This is a great contrast to what we're used to back home, where the threat of COVID-19 surge is still real, and we're still wearing masks, a reminder of some of the iniquities in our world today. Madam President, this year's theme is timely, as it is a reminder of peace as a core component of public health. Health service delivery requires an enabling environment with peace as the bedrock. In the same vein, we believe that health is a human right, just as much as we appreciate the sovereignty of states and other fundamentals of our common humanity. In our quest to attain universal health coverage for our people, we have embarked on a decentralization process of health services to strengthen primary health care. The African region is threatened by various health emergencies, and therefore, collaborative and regional partnerships are vital in responding to health. Zambia hosts the Southern Africa CDC Regional Collaboration Center. We will thus use this privilege to promote preparedness, not only for threats such as COVID-19, influenza, Ebola, polio, HIV, TB, but even for non-communicable and neglected tropical diseases. Key to this is sustainable health financing, especially with local resources. Maternal and child health systems have particularly suffered during the pandemic. As livelihoods begin to rebuild following shocks of COVID-19, issues of malnutrition and other previously controlled problems may resurface.
Please
We
conclude your
therefore need to
statement.
rededicate ourselves to ensuring that stunting, anemia, low birth weight, we need to create a supportive environment for the implementation of comprehensive food and nutrition policies. Madam President, I wish to end by emphasizing again, in line with the theme, health for peace, peace for health. Therefore, let us all endeavor to uphold peace. I thank you.
Thank you. I now give the floor to the delegate of New Zealand, and then we will have a pre-recorded intervention by the delegate of Morocco.
Director General, esteemed fellow ministers and colleagues in the Indigenous language of New Zealand, tēnā koutou katoa, greetings to all. Aotearoa New Zealand is alarmed at the catastrophic and complex health crisis evolving in Ukraine. We reiterate our call for an immediate end to Russian hostilities against Ukraine. Chair, this 75th session of the World Health Assembly comes at a critical time. The COVID-19 pandemic continues to create a heavy burden on people and health systems. And while the international system mobilised quickly in early 2020, our collective response has been inadequate to date. Now is the time for us to act more decisively together and with speed and ambition so that the world can move through the acute phase of this pandemic and does not face a health emergency of this magnitude again. Collectively, we can make real progress on improving pandemic prevention, preparedness and response. More effective global rules and a resilient health architecture are critical. We need better systems, tools and frameworks to respond rapidly to outbreaks with epidemic and pandemic potential. And equity must be at the heart of our approach, equity within and between countries. Chair, the existing global health system has many sound elements, such as the international health regulations, but our rules lack the coherence and status that they deserve, and there are gaps to be addressed. Aotearoa New Zealand is committed to a new legal instrument to support pandemic prevention, preparedness and response through the work of the Intergovernmental Negotiating Body. And we must also commit to strengthening the World Health Organization. As members, we are best served by a World Health Organization that is empowered to do its job. We need to strengthen governance and put the organization in a more sustainable funding position. That is up to us as member parties, as member states. Predictable and flexible financing for the WHO is a priority for Aotearoa New Zealand, and we are pleased with the progress being made on this front. However, we are at the start of an ambitious journey, one that will require focus, courage and compromise. He ora te whakapiri, he mate te whakatākiri. This traditional saying from Aotearoa New Zealand reminds us that there is strength in unity and disaster in discord. We must commit to the path of unity. The pandemic continues to underscore the value of collective action and the importance of upholding inclusivity in matters of health. There should be no room for politicisation as global threats require a truly global response. Chair, good health, economic prosperity and social well-being are interdependent. Together, we can build a healthier and more resilient future for our countries and for the world, New Zealand is fully committed to this future. Tēnā koutou katoa.
Thank you. I now give the floor to the delegate of Morocco for pre-recorded intervention and would like to invite the delegate of Malaysia to come to the rostrum.
بسم الله الرحمن الرحيم والصلاة والسلام على أشرف المرسلين. Monsieur le Président, Monsieur le Directeur.
Madam Chair, Director General, Your Excellencies, ladies and gentlemen, it is a real honour for me to be with you today with my delegation at the 75th World Health Assembly on health for peace and peace for health, which is a relevant choice given the international context, which is very much marked by the health crisis, added to which we see an increase in tensions of political and geostrategic problems, as well as the worsening climate crisis. These numerous challenges show how much it is important to deepen health and peace through collective, concerted and innovative efforts so that we can change the course of history to find a more sustainable, peaceful and healthy world. Therefore, the Global Initiative for Peace for Health, launched in 2019, which our country is committed to, defends these principles, which is focused on inclusion, local governance, and taking into consideration the specificities of contexts. In line with this, we welcome the actions that have been undertaken by the Eastern Mediterranean Regional Office, particularly those initiatives that have been organised by the Sultanate of Oman on the consequences of the pandemic linked to COVID-19 on health and peace. In fact, the health crisis has shown that we need to focus our efforts on the 2030 agenda, which focuses that it is not possible for us to have a sustainable development without peace, and we need to have a collective conscience so that we improve our investment in a system, a health system that is more resilient and equipped to deal with the material and human crises which it faces. Chairman, ladies and gentlemen, no country can work alone to deal with a crisis, and Morocco, under the vision of King Mohammed VI, has shown that it wants to contribute to ensure that there is equitable and safe distribution of the vaccines to its populations on the African continent. And we have established a plant for the anti-COVID vaccine, as well as other vaccines. This project, which is a part of the, which makes the Kingdom of Morocco a biotechnology hub in Africa, means that we will be able to deal with health emergencies, as well as ensuring that we can meet our triple billion targets set by the WHO, as well as the SDGs in the 2030 agenda. We need to ensure that we have a universal health care coverage so that we can overcome health emergencies. Under the leadership of His Majesty King Mohammed VI, we have broadened our social protection floor, and we have also ensured that we are able to broaden our health insurance, as well as broadening our pension schemes.
I now give the floor to the delegate of Malaysia and would like to invite the delegate of Georgia to come to the rostrum.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Madam President, distinguished delegates, ladies and gentlemen. The theme for this year's assembly, Health for Peace, Peace for Health, could not be more timely. As we slowly emerge from the pandemic, hopeful for better days, the world now finds itself in greater peril. War threatens humanity, both those directly affected by it and those staring at possible hunger unrelated to a conflict halfway across the world. Malaysia thanks the Director General for reminding us that the profound consequences of war on the health of human beings are happening not just where the news is focused on now, but in so many parts of the world where conflict is endemic, including in the occupied Palestinian territory, where there is no end to the oppression against the Palestinian people. Economic disruption caused by the lack of peace will plunge billions into poverty. This will exacerbate socioeconomic determinants of health and derail our vision of health for all. Planetary health continues to worsen, and we now know more than ever the health of our planet is inextricably linked to health outcomes of human beings. Climate change has wreaked havoc on food supplies. The next zoonotic pandemic is no longer a hypothetical, but a near certainty. Neglected tropical diseases such as dengue that affects countries like mine are now a concern of other countries because of global warming. And yet there is hope. Malaysia supports recommendations for sustainable financing that will make the WHO fit for purpose. We support reforms towards an international health architecture that will avoid catastrophic moral failures in our response to COVID-19. However, any amendments to the international health regulations will have to respect the principles of equity, accountability, and transparency, and the sovereign process of member states. Yes, by all means, hold member states accountable in disclosing key information of public health concern. But let us also call for the disclosure of intellectual property and manufacturing know-how of vaccines, diagnostics, and therapeutics. Let us put mechanisms in place now for the fair and equitable distribution of resources needed in future pandemics. We should build back better, but equitably, with no country left behind. In Malay, we have a saying, berat sama dipikul, ringan sama dijinjing. We must not only share in the pain, but also share in the cure and the recovery. Finally, Madam President, Malaysia would like to call on all health ministers and officials here to be the voice of peace and social justice in your respective governments, to fight for universal health coverage for all our people. Let us honor the sacrifices of our healthcare workers during the pandemic by demanding resources needed to build resilient healthcare systems, for health to be seen as an investment and not just a budgetary line item, and for us to better look after the physical, the mental, and the spiritual well-being of our people and the health of our shared planet. Thank you very much.
Thank you. I now give the floor to the delegate of Georgia, which will be followed by pre-recorded intervention by Iraq.
Honorable Director General, Excellencies, ladies and gentlemen, I am privileged and honored to address such a distinguished audience. At the outset, let me express our full solidarity with and support to Ukraine. We are gravely concerned over the ongoing health emergency in Ukraine, resulting in conflict-related casualties as well as increased risks of illness and death from non-communicable and infectious disease, gender-based violence, and of sexual and reproductive health, including maternal and child health deterioration. We reiterate Georgia's unwavering support to Ukraine's independence, sovereignty, and territorial integrity within its internationally recognized borders. We welcome the consolidated report presented by the Director General. Indeed, there cannot be health without peace, and there cannot be peace without health. During the current crisis in the region, joint efforts at national, regional, and global levels for accelerating the implementation of SDG goals become even more important. The government of Georgia remains strongly committed to achieve universal coverage with essential services and ensure access to high-quality, life-saving drugs for the entire population. With support of international partners, Georgia has successfully overcome challenges of the recent pandemic. The government made substantial investments for strengthening health systems and building capacity for healthcare workforce in emergency response, COVID-19 vaccines and novel drugs have been quickly mobilized to minimize risks for most vulnerable communities and avoid life loss due to the pandemic. The National Health Strategy intends to further strengthen primary care services by building capacity of nurses and introducing telemedicine in remote facilities. The scope of the UHC program will soon be expanded to cover rehabilitation services, early cancer diagnostics, and organ transplantation. In order to further move towards progressive universalism, we are committed to improve access to drugs for major cardiovascular disease, cancer, and rare conditions. Since 2015, Georgia has achieved substantial progress in reducing the burden of tuberculosis, HIV, and hepatitis C. Georgian health agencies have been actively disseminating this experience to other countries in the region. The effective intersectoral collaboration, engagement of civil society actors, and strong global partnerships have been key drivers to successful implementation of complex public health programs. Regional and global partnerships enabled us to advance our health security agenda. I hope positive health reforms that are currently undertaken in the country in line with the EU-Georgia Association Agreement and will lead us to the desired outcomes in health and social protection. Thank you for your attention.
Thank you. Now I give the floor to the delegate of Iraq for pre-recorded intervention and would like to invite the delegate of Andorra to come to the rostrum.
السيد رئيس الجمعية، أصحاب المعالي والسعادة، السيدات والسادة المحترمون.
Madam President, ladies and gentlemen, we are delighted to be here attending this World Health Assembly. We wish to begin our comments by thanking all of those who've been involved in preparing the very important documents that we are considering here. From the very start of the pandemic, my country took every possible measure to bring the situation under control and to prevent an adverse impact on public health and on our health systems. We took all of the internationally recommended measures in our country in order to limit the damage caused. We were able then to rise to this challenge. We strengthened our reception capacity in hospitals and in particular our ability to provide primary health care. We recognize that all countries need to take a number of measures in order to respond to emergencies and to overcome any shortcomings that may exist within their system. That means that we need to strengthen the IHRs. And WHO has recognized that. They are indeed now proposing amendments to the IHRs. And we ourselves have strengthened our system, fully respecting what is contained within the international health regulations, because we know that failing to comply with the IHRs has a very, very serious impact on global health. We believe it's important to exchange information on pandemics, and we need to have mechanisms that allow us to exchange information as early as possible. Early intervention is vital, and we need to get the green light from countries to intervene when that is required. We also need to strengthen the governance of WHO. Again, this is extremely important for our future in terms of global health, and we need to ensure that WHO is well placed to help countries deal with the challenges of future pandemics. That means taking measures that will overcome health inequities, because there are inequalities today in terms of access to pharmaceutical products and vaccines. Those inequalities must be overcome. As well as that, we need to ensure that our preparedness and response capacities are enhanced. That will require new instruments. For instance, a new international convention. And we know that a new binding international convention would be a very significant step forward. I would like to conclude these comments by once again thanking WHO for what it does. Special thanks are due to the country office in Iraq. I thank them for all of the assistance that they give us as we seek to reevaluate our health system and see what needs to be improved. Ongoing evaluation is the way forward, because we need to be assured that our system will continue to be able to deal with challenges that may emerge in future. In our country, we've taken a very cooperative approach. We have been able to enhance coordination and work across the board. The delegate has now been cut off.
I now give the floor to the delegate of Andorra, and I will invite the delegate of Lebanon to come in the rostrum.
Merci, Madame la
Thank you, Chair, Director General, Your Excellencies, ladies and gentlemen. It is an honour for me to be speaking on behalf of the Principality of Andorra. This session of the World Health Assembly will allow us to look at the current state of affairs, and we hope that it will lead us to taking decisions that will optimize healthcare measures at all levels in the next few years. It is now the time for us to learn the lessons from the collective management of the health crisis, so that we can strengthen the multilateral architecture of health. Andorra will actively participate in the debate which promotes strengthening the normative role of the WHO, so that we can also have better funding for the World Health Organization, so that we can also deal with future health crises. Furthermore, we believe it is very important for us to work collectively so that we can strengthen the implementation of the international health regulations. Andorra supports, therefore, the proposal of creating a universal periodic review for health, which would allow us to improve our ability to react as soon as the first signs of an epidemic appear. As a representative of a small country, I would also like to remind members that our country's size should be taken into consideration when we review the international health regulations and when we develop a new instrument. Your Excellencies, dear colleagues, the COVID-19 pandemic has affected people physically, but we must not forget it also affected people mentally. We have seen different trying times that people have had to live through, and this has led to a lot of mental health issues affecting certain parts of our population, particularly adolescents and certain healthcare professionals. Recent statistics in our country show that around 40% of the population has had or currently has signs of depression or anxiety, which have been caused by the restrictions because of COVID-19. This health crisis has shown us how important it is to ensure that we have mental health support. The Principality of Andorra is committed to this with determination and conviction. Recently, we adopted in February 22 the Mental Health Global Plan and the fight against addiction. This plan is a preventive plan, and it is both original and effective. Ladies and gentlemen, we would like to reiterate our commitment as Andorra to strengthen the World Health Organization so that it can ensure inclusive multilateralism and one based on solidarity. Thank you for your attention.
Thank you. I now give the floor to the delegate of Lebanon and would like to invite the delegate of Democratic Republic of Korea to come to the rostrum.
Madam President, Your Excellencies, Director General, distinguished delegates. I would like to start by congratulating Dr. Tedros on his appointment for a second term, wishing him success in his upcoming endeavors. In our region, unfortunately, conflicts have been the norm for several years, exerting a heavy toll on countries as a whole and on their health system in particular. In August 2020, and during a severe financial crisis and an unprecedented global pandemic, Lebanon was hit hard by the Beirut port explosion. This humanitarian disaster shook the country. As a result, and in addition, from the tragic deaths and casualties, health facilities were demolished, a significant number of healthcare workers left the country, and many were left with physical and mental wounds and inadequate access to their much-needed health rights. Meanwhile, conflicts in the region continue to result in the continued influx of refugees to Lebanon. This constitutes now around 1/3 of the Lebanese population. Lebanon is a host to the largest per capita refugee population in the world. Nonetheless, with a strong belief in equity and human rights, and despite all the challenges, the displaced and migrants have been well integrated in our healthcare system. We do believe that with the disruption comes opportunities and possibilities to change. We recognize the potential for building a stronger and more resilient and healthier system. More importantly, we recognize that investing in health is equivalent to investing in peace. However, this burden should not be Lebanon's to bear alone, and our country deserves active support and solidarity from the international community. Madam President, the latest COVID-19 pandemic has emphasized to all that we are not safe until everyone is safe. Wars have no borders, and so does peace. We believe that peace and safety are a common good and a shared responsibility, and thus we support the global initiative led by the WHO to achieve peace for health and health for peace. Thank you.
Thank you. I now give the floor to the delegate of Democratic People's Republic of Korea.
Thank you, Madam President and Mr. Director General. It is common desire and ideal to live a healthy life in a peaceful world. But the pandemic is posing a great threat to the life of safety of humankind. Although the world appreciates all the efforts and commitment in the fighting against COVID guided by WHO, today's crisis emphasizes once again the need more of global cooperation in averting current epidemiological state and preventing the spread of the malicious virus. Giving an utmost importance to safety and improved health of the people, the DPRK government continues to increase its investment in the sector of public health. The government has conducted in a systematic way to switch over to advanced and popular epidemic prevention system through increased allocation of budget by 133% as compared with last year. The law on child care adopted at the Supreme People's Assembly legalized as a state policy to provide all children with a more improved fostering conditions and supply them with the dairy products and other nutritional food at the state expense. Recently, the most serious emergency case occurred in DPRK, making a break on our emergency epidemic prevention system has been firmly defended over 2 years due to inroad of the malicious virus into my country. To cope with the current situation, the government lost no time in shifting the state epidemic prevention system to the maximal level and has been conducting vigorously the epidemic prevention warfare. Comrade Kim Jong-un, the President of State Affairs of DPRK, laid out the detailed ways and practical measures to perfectly block and terminate the source of malicious virus spread. He is personally taking the lead in this warfare. The DPRK government will surely overcome the public health crisis faced in the country at the early possible date for health and life safety of our people. Mr. President, the issue of strengthening the existing international health regulations and newly adopting a so-called WHO Convention on Pandemic should be directed towards preventing, preparing for in time, and responding swiftly to pandemic in all aspects. In this work, the principle of fairness and equity should be maintained. It is our position that any dishonest attempt to politicize the activities of our organization should not be tolerated, and the priority should be given thoroughly to the principle of respecting sovereignty of member states. The DPRK will always be faithful to the responsible duty to protect life of the people and to promote their health and welfare. It
Please
also
conclude in
will
few
make
seconds.
active contribution to building a sound and fair global health system in the future too. Lastly, I would like to congratulate Director General on his deserved re-election. I thank you.
Thank you. I now give the floor to the delegate of Togo.
Madam President, Director General, Ministers, colleagues, Excellencies, ambassadors, distinguished guests, ladies and gentlemen, it is an honor and a pleasure for me to address you at this, the 75th World Health Assembly. I wish to take advantage of this opportunity to extend, on behalf of the government of Togo, my sincere thanks to WHO. We are grateful to WHO for the many kinds of assistance it provides to my country. Ladies and gentlemen, allow me to pay tribute at this moment to all of us who have lost their lives in the course of the COVID-19 pandemic. After almost 2.5 years of the pandemic, the world is now realizing just how destructive the pandemic has been to societies, economies, and global health. In that difficult situation, we thank WHO for the driving force it has been in organizing pandemic response by providing to us technical and financial assistance, but also, first and foremost, by creating the COVAX mechanism and the ACT Accelerator. These were the mechanisms that allowed vaccination to begin in my country. I would also like to thank the African Union and other international organizations that have worked with us, also regional assistance and friendly countries. I thank all of those who have supported us as we have sought to run a vaccination campaign against COVID-19. We have lived through various waves of the epidemic, and we took the appropriate global health and public health steps that were required. We have also sought to roll out a wide-ranging vaccination campaign so that we can return to a normal life in our society. Having said that, we wish to move on to talk about the theme of this conference, Health for Peace, Peace for Health. We believe that is a particularly relevant theme today. It is true that health and peace are two vital sources of enrichment in our lives, and they cannot be ignored. Without peace, however, health can only be dreamed of. Wars, terrorism, violent extremism, these things threaten people's health. They also destroy healthcare systems, and they have a negative impact on child development. As quickly as possible, then, we need to learn from the tragedies that we are witnessing today. We need to understand that we cannot take peace for granted. We need to call upon our individual and collective consciences to work together to find a consensus-based approach, an approach based on justice and equity that can build a world of peace. That is essential if we are not to jeopardize all that we have done thus far in promoting global health, because we see that there are real threats to global health today, apart from pathogens of the type that caused COVID-19. We need to recognize that peace and health go hand in hand, and in Togo we have integrated them fully within our plans, programs and policies. Ladies and gentlemen, Togo wishes to congratulate the Director General of WHO, Dr. Tedros, on his re-election to lead this organization forward, and we wish him every success in that task. Thank you.
Thank you. We have now concluded our work for the morning. Before we close, I would like to remind delegates that the strategic roundtable urgent paradigm shift towards preventing disease and promoting health, economics of health for all, will take place today at 1 o'clock in room 26. The fifth plenary will meet this afternoon at 2:30 to consider item 4 of the agenda, post of the Director General. The sixth plenary will meet this evening from 6 o'clock to continue discussions on agenda item 9 reports of the main committees and item 3 general debate. The meeting is adjourned. Thank you.